Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, after months of waiting since the start of the corona pandemic, President Rodrigo Duterte lifts the travel ban on nurses, doctors, and healthcare professionals. But an annual cap of 5,000 will be imposed to ensure that the country will still have enough medical frontliners amid the COVID-19 crisis. A group of nurses lauds the president's decision to lift the ban but calls for better treatment and hazard pay rage on. Labor Secretary Silvestre Bello III and Filipino Nurses United National President Maristella Abenojar join us live. President Rodrigo Duterte approves the lifting of the temporary deployment ban for nurses, doctors, and other healthcare workers. The ban took effect last April as the government tries to secure enough number of medical frontliners at the start of the coronavirus pandemic. The Labor Department says that for now, only 5,000 medical workers will be allowed to leave the country every year, subject to further assessment. Let's go straight to the source of the story. We have Filipino Nurses United President Maristella Abenojar. Maristella, welcome to the source and thank you so much for your time.
Good morning, Ms. Pinky, and to all the viewers and followers of The Source.
Maristella, it's been 8 months. We have talked about this a few times. So, masaya kayo that finally na-lift na itong total deployment ban sa mga healthcare workers. Pero sabi mo sa akin kanina before we went on air, hindi kayo ganap na masaya.
That's true, Ms. Pinky. First, we would like to congratulate our PRISO nurses. This is the group of nurses affected by the temporary suspension of deployment ban, for they have finally achieved this kind of victory where the government really lifted the ban. However, the joy is not totally complete because of the 5,000 cap. We feel that this is not the solution if we want to entice our nurses to work in the country. And remember that we have an average of around 13,000 nurses going out of the country every year. So if we only have 5,000 limited number of health workers to be allowed to work in other countries, how will the 14 other categories of health professionals share the 5,000 allocation for working in other countries? So this is not really very clear. And in fact, one of the recruitment consultant, we have learned from him that 5,000 is just 1/4 of the total number of deployed healthcare workers for the Middle East. So this is not really the solution to our problem. In fact, what we are urging in our organization is for the government to really provide the timely salaries and give the compensation due for them so they can entice more nurses to work here.
So let's talk about that. Ang sinasabi mo, on an average, there are about 13,000 healthcare workers that actually leave for abroad.
Nurses. That's only for nurses 13,000. So, yes. And we have a cap of 5,000 that will be divided with 14.
Absolutely.
Yes.
Yeah. Oo. Kasi yung 13,000 nurses lamang yan every year. Idagdag mo pa yung mga doctors, yung iba pang specialists doon sa every year na umaalis ng Pilipinas, obviously for better pasture, greener pasture rather. So, doon sa 5,000, has there been any information sa inyo sa Filipino Nurses United kung sinong mauuna? Kasi ang mangyayari dito, kung may 5,000 na cap, siguradong mag-uunahan, umalis yung mga healthcare workers na meron ng mga papeles.
Very true, Ms. Pinky. Hindi clear. It's not clear kung paano isi-select ang 5,000 health workers na paaalisin ng ating bansa. Right now, meron tayong naka-standby na almost 1,500 bound for the Kingdom of Saudi Arabia. Meron po tayong less than 100 bound for other European countries like UK and Ireland. At meron pang ibang mga destination countries. So we are not very much clear of how the POEA and Department of Labor and Employment will do the processing or selection of the 5,000 healthcare workers.
Okay, granted, though, Maristella, that the president or this was decided upon over the weekend, Monday pa lang ngayon, at sinabi na nga na approval. So yung fine print or the, the procedures or the protocol or kung paano ito mangyari should come out the soonest possible time. What about talks with Labor Secretary Silvestre Bello? Nagkaroon na ba recently since the approval of the president?
Wala po akong personal pa na talk with Secretary Bello, but I heard yesterday he was interviewed na they can extend it up to 8,000 healthcare workers depending on the situation according to him. But as I was saying a while ago, the 5,000 cap is really not the solution if we want to entice more healthcare workers to work here. First, we have to show our sincerity of the government to really help our healthcare workers by giving them timely salaries. We have several complaints from our nurses that they have not been paid on time for 2 or 3 months of their salaries. And others were not able to receive their hazard pay and special risk allowance in the past several months.
And they continue to work, Maristella, kahit na hindi sila nabayaran ng 3 hanggang 2 to 3 months?
Yes, until now, they are still working and hoping na sana ibigay na ito. Malapit na ang Pasko, Miss Pinky. And you know very well na pag breadwinner ka, it's so difficult na hindi mo alam saan mo kakukuha ng ibibigay mong ipapakain mo sa pamilya mo, or ipambibili mo ng gamot ng iyong parents or education ng iyong anak or ng mga kapatid. It's too difficult. 2 to 3 months delayed in salary is really not unjust. No? Hindi na ho ito makatarungan.
And you were telling me a while ago that there was a hearing on this, I believe, November 18. So last week lamang ito. What came out in that meeting? And was there any solution to this allegation of yours, to what you're saying, that a number of nurses have not been paid, whether basic salary, hazard pay, or risk allowance pay, the past 2 to 3 months?
We have informed our legislators prior to that hearing that we have this concern. In fact, it is connected to our proposed upgrading of salaries of our nurses, because you know very well, Ms. Pinky, that they have been demoted. Our government nurses with positions of nurse 2 to nurse 7 have been demoted. So we are appealing for salary upgrading for our nurses. And in line with that, we raised about this issue of delayed payment of their salaries and their hazard pay. So during the Senate hearing last November 18, Senator Pangilinan, Kiko Pangilinan, and Senator Ralph Recto raised this to the Department of Health. And DOH admitted that there were 16,764 health workers who have not received their hazard pay and special risk allowance, and some of them also have not been given their timely salaries. On top of that, Ms. Pinky, we have 4,275 health workers in the Philippine General Hospital who are still hoping to get their hazard pay and SRA, because since March, when PGH was declared as a COVID referral patient, they have not received these benefits. And also there were emergency hired personnel under the Department of Health that did not receive also their salaries on time and the hazard pay and SRA.
We are going to talk about the other concerns of our nurses, what they're going through. And as soon as we get Secretary Bello on the line, we will discuss these concerns with him, but we'll be taking a very short break. The Source will be right back. You're watching The Source on CNN Philippines. Our guest today, Nurses United, Filipino Nurses United President Maristella Abenojar. You know, Maristella, it seems that there are so many problems when we actually pagbalikan ko yung inyong mga concerns in the past. It was syempre tanggalin muna itong deployment ban, nagkaroon ng partial, and then ngayon nagkaroon ng total. But it doesn't seem like it's a total deployment ban because you're saying with a 5,000 cap, it doesn't measure up to the word total deployment ban. And then you're bringing up even other issues as how many nurses would you know have not been paid in the past 2 to 3 months? Dun muna tayo dun sa basic salary. Would you have a number?
I think the Department of Health should have the exact figure on this because they are supposed to monitor our health facilities. Now, what we receive in the Filipino Nurses United are complaints from different hospitals, but we don't have a total figure in the country. But we know very well that, like for example, the SG-15, the salary grade 15, it's not yet implemented fully in our government hospitals. Yesterday, I was talking to some nurses of Quirino Memorial Medical Center, and I have learned that until this time, it has not, the SG-15 is still on park. No? The finance unit said, of their hospital said that they are waiting for the release of budget from the Department of Budget and Management. So until now, their salaries are still pegged at SG-11, which is 22,316. And ironically, President Duterte signed yesterday a law that increasing the bed capacity of Quirino Memorial Medical Center from 500 to 1,000 bed capacity. So that means additional manpower. And yet, the existing manpower of nursing unit has not been compensated well. The same thing with other hospitals, like for example, in East Avenue Medical Center, this is also one of their showcase COVID referral hospital. But many of the nurses and doctors who are under the emergency hiring there have not been paid for a delay of 2 to 3 months of their salary. Some ended their contracts already and have not been fully paid of their back wages. They also do not have the hazard pay and SRA in their contract. No? And that is also the appeal of our health workers because we are having we are contracting the disease as well. We have around 4,060 nurses now infected with COVID-19 as of November 7 data of the Department of Health. And we know very well that the COVID cases in the country is still rising. It's almost 419,000 now. And many of our health workers also are dying because of this disease. And yet we are just not given proper attention. FNU believes that if the DOH comes up with a policy, they should monitor the implementation of this. No? They should know very well how many of their health workers are receiving the benefits due for them.
How can this be resolved in terms of, let's say, your group, the Filipino Nurses United? What can you do to be able to address some of your concerns?
Well, what we are doing already, Ms. Pinky, is lobbying and negotiating with our concerned government officials. We already have series of dialogues with Department of Budget and Management, Department of Health, and even with Department of Labor for the concern of our nurses in the private sector. So we also raised this concern with our legislators, both in the House of Representatives and in the Senate. We're hoping that they will attend to this urgently because this is something very urgent at the moment. Their families are starving, no, they're getting ill, and yet they're not compensated. I mean, what's the reason? If DOH is explaining it from the point of view of wala ng pondo for Bayanihan 1, then they should source out funds for this. Dahil nagtrabaho na ang mga health workers, dahil na-expose na sila. It's not just na dahil ubos na ang Bayanihan 1, ay iiwanan mo na yon hanging at hindi mo na ibibigay, di ba? After all, Miss Pinky, what our health workers and nurses are asking is benefits due for them by law, and this is also coming from the people's money, from people's taxes. It's not from their own pocket. So why not righteously implement what is due for our health workers? What's keeping them delayed about this?
Because you have, and because nakipag-ugnayan na kayo sa various government agencies at gayon din sa mga congressmen and senators, and still this problem persists, is there another course of action you're looking at?
Well, napipilitan na pong lumabas ng mga ospital ang ating mga health workers kasama ng mga nurses. Last Friday, nag-stage na po ng sit-down protest ang ilang mga nurses natin sa labas ng ospital. Meron na rin pong nag-picket rally sa loob ng ospital. We are already doing extra activities. Marinig lang po kami ng ating pamahalaan at malaman ng ating mamamayan, ng public, anong nangyayari. That's why, Miss Pinky, I am actually very thankful sa mga katulad po ninyo na kaibigan namin sa media, because you're giving us a chance na ipaalam kung ano yung nangyayari. And hopefully, marinig po nila kami. Pasensyoso ang mga nurses, Miss Pinky. Mahaba ang aming pasensya. Imagine, 18 years bago ma-implement ang SG 15 since the law was passed in 2002, yung nursing law. Tapos ngayon na dapat mai-implement na, hindi na naman, naudlot na naman. At ang iba, nag-implement na ng SG 15, nag-revert back pa, pinawi, ibinalik sila sa SG 11 dahil sa ilang mga kaguluhan. And ito ang ating ilang government officials na hindi man lamang kumilos ng mabilis. Sana naman po ay pakinggan nyo naman po kami. We don't know, Miss Pinky, ano pang pwedeng gawin ng mga health workers sa mga susunod na araw, no? Pero sana wag na nila kaming hintayin pa na gumawa pa ng mas iba pang drastic actions. Imagine we are the 60% of our health workforce in the country. May hirapan po kayo pag kami po ang nawala sa inyong serbisyo o kung kami ang magkasakit at magkulang ang personnel sa mga ospital. Kaya sana naman po, pakinggan po ninyo
Here's
kami.
the thing.
Ibigay na po yung aming kailangan.
Here's the thing, Maristella, kung ganyan ang problema ng ating nurses, because you're speaking for the nurses, I remember Congressman Mike Defensor had proposed, sabi niya dapat ang entry level pa lang ng mga nurses, entry level both in public and private, dapat daw madoble to about 60,000 pesos.
60,000.
That's one way to entice our nurses to actually stay in the country. But with problems like this arising, I wonder what will really make them stay. We're going to take a very short break. The Source will be right back. Welcome back to The Source. Our guest today, Filipino Nurses United President Maristella Abenojar. So, Maristella, we're still trying to reach Secretary Bello. I'm not sure kung makakausap pa namin siya, but we will try in the event that we don't get to speak to him today, na makausap siya sana bukas or the day after. Maybe, Maristella, just an appeal to authorities as a last question. Anong apela ninyo?
Ang amin pong panawagan sa ating mga concerned government officials na nasa Department of Health and DBM at Interagency Task Force, sana po gawaran ninyo ng tamang katugunan ang mga kahilingan ng ating mga nurses. We appeal for our timely salaries and back pay para sa mga delayed salaries, at ibigay po ang hazard pay and special risk allowance na nauudlot, hindi pa po na ibibigay for several months. Sana po ibigay na natin yan sa kanila. Ang kanila pong mga pamilya ay nagugutom din. Ang kanilang mga pamilya po ay affected din ng COVID-19. So, pansinin po ninyo ang panawagang ito. alam ko po na nung nagreklamo si Governor ng Chis Escudero ng Bicol, ay agad kayong tumugon, ang Department of Health. Sana po, kami man po ay bigyan ninyo ng pansin. In fact, nauna pa po kaming nagsabi sa inyo kay Governor Chis Escudero na maraming hindi nababayaran. Pero hindi po ninyo kami nasasagot. So this time, sana yung boses ng mga nurses ng 60% ng inyong workforce sa healthcare industry ay pakinggan ninyo. Secondly, sana po maglabas na ang Department of Health ng malinaw na explanation sa lahat ng ating government facilities, hindi lang po under DOH, but even LGUs. Ilagay po ninyo ito sa inyong department order na ang SG-15 ay dapat i-implement. At ang inyong sinususpindi lamang ay yung demotion ng Nurse 2 to Nurse 7.
Maraming salamat, Filipino Nurses United President Maristella Abenojar.
Gandang maga po. Thank you.
And as I mentioned a while ago, we've been trying to reach Labor Secretary Silvestre Bello III, but apparently right now he is in a meeting. But meantime, Secretary Bello was saying that the government can actually expand this recently approved 5,000 cap on the deployment of healthcare workers abroad every year. On Saturday, President Duterte has again allowed nurses and other medical workers to leave and work abroad. Healthcare workers groups welcome the development. However, some still express concern over the yearly cap. They say the limit is not workable unless the government pays the several months of delayed salaries and special risk allowance for all healthcare workers. The overseas deployment of healthcare workers was earlier suspended in a bid to keep medical professionals in the country to boost the local fight against the coronavirus pandemic.
That is the assessment of the OEA and the Department of Health. And besides, you inform yung mga nurses natin na yung cap of 5,000 is also temporary. Kasi this is subject to a regular assessment. Kasi kung kaya pa magpadala, we can always expand the cap. Instead of 5, probably we can raise it to 7 or 8,000 ganon. Depende sa sitwasyon sa ating bansa.
Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.